Alrighty. Hello, my friends. It's Jill Osborne from the IC Network. It is Sunday, October 27th. It is a couple of days before Halloween. And you know what? Halloween is my absolute favorite holiday. So I decided not long ago that I was going to dress up. Hold on one sec. I have to take something. There we go. Setting up a live stream is always fun. All right, my purpose in doing so. Let me start that all over again. Hello, my friends. My name is Jill Osborne. I'm the president and founder of the Interstitial Cystitis Network. It is time for another live IC support group meeting. It is Sunday, October 27th. It's a couple of days before Halloween. And you know what? I happen to love Halloween. It's my favorite holiday, so I decided to play today. My purpose in doing these meetings is to make you so strong, so knowledgeable, so informed that no one can mess with you. I don't want anybody telling you that you're damaged goods. I don't want anybody telling you that this is all in your head. I don't want you to believe that there's absolutely no hope, because there is always hope. You know, and the best part now today, it's unlike 20 years ago, we didn't have good treatments. Now we do. 20 years ago, we didn't understand what caused IC. Now we do. Now we understand why so many patients didn't respond to bladder treatments. Now we can make that much better for them. And so we have a lot of really good things happening in the IC world. Hello, Gay. Nice to see you. So right now I'm Somal Casting. When I'm looking here, I'm looking at Facebook. When I'm looking over here, I'm looking at YouTube. In fact, I should move that computer so it's a little bit closer. But anyway, it is what it is. So as an IC patient, as a longtime pelvic pain patient, myself, as now a breast cancer survivor, I have made a lot of changes in the last year. You can't let illness or injury stop you from being happy. You can't let illness and injury stop you from making great memories, because we're always going to have something. Sometimes it's very intense. Sometimes it's very mild. But I am very determined now to try to find my happy again, because I've had a rough year. The other thing that I realize that has contributed to me not feeling very happy is social media. And sitting there and looking at all the stress, and people being snarky and people fighting and people doing this and people doing that. And before you know it, you haven't just lost an hour, you've lost 2 hours, you've lost 4 hours watching videos, watching shorts, watching TikTok, etc. And you'll never get that time back. And so I have decided that I want to make things. I don't want to lose that time. I want to leave something behind. I want to make things. And so I'm painting, I'm quilting, I'm doing all sorts of stuff. And years ago, I used to sew a lot. I used to actually design things. And so I give to you my first Halloween costume in 20 years. How do you like this, baby? Just a couple weeks ago, I went, I'm going to make something. So my goal here is to be kind of like an ethereal witch or fairy. I don't know what, but I'm just playing with it a little bit. Thank you, Gay. And everything was on sale and it's just super fun. I put on this part this morning. It's just fun. It's just fun to leave things behind. Okay, so normally when I do these meetings, I do a little 30-minute intro, and then I'm going to take any questions you have. I'll be here as long. Well, I can't say I'll be here as long because we have a a third birthday party this afternoon. And so I'm only going to be here for a couple of hours if we go that long. Anna says it's fantastic. Oh, honey, thank you so much. You know, I'm always surprised when girls today don't know how to sew, because that was like a given for when I was young. We all had to learn how to sew, and I even took some sewing classes in college and pattern making. So I just like to make stuff. Okay, so I will take questions as long as we can, but let's just continue this theme of Halloween just a wee bit, shall we? So what are the most spooky things that you can eat that we know are going to trigger an IC flare? Number one, well, okay, understand first, not everybody's IC sensitive. Quite a few of us are not. Not everybody's diet sensitive, I meant to say. Quite a few of us are not. And that's always weird, because you come into a support group meeting and there's somebody who can drink coffee every day, and man, you can't even breathe it without a flare. Why are there such different individual tolerances for food? And why is it that some of the foods that we've had for years and years that we've been able to eat, all of a sudden they trigger IC flares? Okay, well, it depends upon your phenotype. So the reason why we are all so diet sensitive is because we're not all the same. So if you have Hunner's ulcers, visible wounds on your bladder, I can guarantee you will be diet sensitive. I can guarantee it. Because you have open wounds in your bladder that urine can now get into. And if you eat something really acidic or really alkaline and it gets into that wound, it's going to hurt like heck. So the people who are going to be the most diet sensitive by far are patients with Hunner's lesions. The next group of patients who are going to be very sensitive to food are going to be people with estrogen atrophy. Women with estrogen atrophy. Why? Because your bladder doesn't have that nice thick coating of mucus that normally protects the bladder wall from urine. Because think about your bladder. How does your bladder defend itself? It has a really thick coating of mucus on the inside. Your bladder's like your mouth. It's a hollow organ that's wet on the inside. And that mucus acts as a barrier. It protects everything. It's thick, it's robust. It's hard for bacteria to chew through mucus. It's hard for irritants to get through mucus, to irritate the cells in your bladder wall and the nerves in your bladder wall. Unfortunately, that mucus is estrogen dependent. So when you're young and have a lot of estrogen, you have a lot of mucus. If you're on birth control, if you're on Lupron for endometriosis, if you're perimenopausal or postmenopausal, you don't have the estrogen anymore, which means you don't have the mucus anymore, which means your bladder's ability to defend itself is now compromised. So you too are going to be food sensitive because the protection isn't there as much as it used to be. And that's very puzzling for them, because in their 40s, they could have a cup of coffee or green tea every day, and all of a sudden in their 50s, they can't. Why? It's just because their estrogen has dropped a little bit more, and their bladder, and they've kind of hit that point of no return, although that's not true, because we can get the bladder better again. But there comes a point in time in many women as they get older where they just can't tolerate certain foods. Okay. Patients with chemocystitis, where you have an injury to your bladder wall. If your IC started after chemotherapy, you too will be food sensitive because you have injury in your bladder. The patients who are not going to be particularly bladder sensitive are going to be patients with pelvic floor driven symptoms, patients with pudendal neuralgia, although there's a caveat to that, and patients with widespread pain. Because widespread pain, if you have IC, IBS, vulvodynia, TMJ, we know that that's a nerve problem. We know that that's your central nervous system that has been injured. So we don't want to injure it anymore. So the food that patients with nerve sensitivity absolutely have to avoid is nerve pain. Is neurostimulants like caffeine, Caffeine is like taking a jackhammer to the nerves in your bladder. Why do people have a cup of coffee in the morning? Because it stimulates a bowel movement. How? Because the caffeine turns the nerves on. Caffeine also stimulates the nerves in the bladder. It makes you pee more. Well, if you already have a super sensitive nervous system and you do something with caffeine, it's going to hurt. If you're going to be a lot more uncomfortable, you're going to have to pee more. Okay, so your food sensitivity, it depends upon your unique case of IC. So what are the spookiest foods for bladder wall sensitive patients that you really have to take a step back from? Number one, coffee, all forms of coffee for at least 3 to 6 months. Even low acid coffee, lose it. Because your job is to create an environment that will help your bladder heal. And so if you've got Hunner's lesions, obviously you put coffee in the wound, it's going to hurt. If you had a wound on your hand, would you pour coffee on it every day? No, of course not. What would happen to that wound if you poured coffee on it every single day? Would it heal? No, it wouldn't. It's going to get worse. Even 1 cup of coffee a day will prevent bladder wall healing. 1 cup of coffee a day will set you back 2 weeks of tissue growth. Now, let me explain what I mean by that. So the bladder wall contains the largest single cells in the human body. We call it the urothelium. Ginormous cells line your bladder. So I want you to think of an extra large pizza and then think about 1 single green pea underneath that pizza. So that pizza is the umbrella cell in your bladder wall. But if that umbrella cell is damaged, how does it get replaced? From the little tiny stem cell underneath it, the pea underneath it. And it takes 2 weeks for that stem cell to grow and change size and fit in where that umbrella cell used to be. But here's the thing. While it's growing, it is exquisitely sensitive to acid. Acid will destroy it. That's not from me. That's from a National Institutes of Health lecture taught by Dr. Anthony Schaefer years ago. We were talking about how does the bladder heal. That stem cell, while it's trying to repair any superficial damage in your bladder, is exquisitely vulnerable to acid. Literally, 1 cup of coffee will destroy an entire generation of cells. And as I was sitting there with my peers from other countries who also run patient groups, we were all looking at each other like, yeah, we knew that. We knew that. We absolutely knew that. But it was nice to see the mainstream explain why the patients who drink 1 cup of coffee a day don't do well. They suffer the most. Hi, Kayleen. Hello, Lori. Hello, Christine. Hi, Jen. Hi, Anna. You guys hold tight. Let me just get through this and I'll come take your questions. So we need you to lose all the big strong coffees for 3 months just to give your bladder time to heal. It needs to heal. And then after 3 to 6 months, if your symptoms have gotten better, then we can start reintroducing maybe an herbal coffee like Dandy Blend, which is not going to irritate your bladder. Maybe a genuine low acid coffee like Bella Rosa low acid coffee or Tyler's no acid coffee. But you got to pick the right time. We have a coffee challenge to determine when is it time for you to try coffee again. Here's the IC Network Coffee Challenge. We've done this for 20 years. If you're in a flare, no coffee, period. Honestly, you would be an idiot to drink a cup of coffee during a flare. But let's say you're feeling a little bit better and you want to test the water. The first thing that you try is an herbal tea, right? Which hopefully you're already drinking, but ideally a brown rooibos tea like a rooibos herbal tea. Herbal teas are, the brown rooibos green teas are Similar to coffee, they're earthy like coffee. They taste great. You can do a lot with them. We have a fabulous pumpkin spice rooibos tea in the IC Network shop that it's a great after dinner tea. So if you do okay with rooibos, fantastic. The next thing you're going to try is an herbal coffee like Dandy Blend. And try that for a couple of days. Let's see how you do with that. If you do okay with that, then the next thing you're going to try is going to be a genuine low acid coffee like Bella Rosa Decaf. These are real coffees that you brew in a pot or in a coffee maker. And we want you to start with a decaf. Don't do a regular. We don't want to jack the nerves up. Let's start with a decaf and see how you do with that. Do that for a couple of days. And if your symptoms get worse, you know to back off. If you seem to tolerate it well, then keep on keeping on. But be respectful of the fact that you have an injured bladder and your job is to create an environment that will support that wound healing. Okay, the second thing that will trigger an IC flare by far is black tea, or even worse, green tea. Green tea is agony to an IC bladder. It's almost worse than coffee. It's that bad. And some of you out there think you've been told, you're supposed to drink green tea. Green tea is healthy. Not if you have an injured bladder or not if you're postmenopausal. Okay? So lose the green teas, lose the matchas. Again, back off 3 to 6 months, slowly reintroduce. But honestly, I think you need to lose green tea altogether. Now we're going to look at energy drinks. Literally the worst, the spookiest drink of all for you to touch. You should not touch. You need to give them away, pour them down the drain, is any sort of energy drink. Massive acid, massive caffeine. Now we have to look at fruit juices. Obviously, lemonade, limeade, grapefruit juice, tomato juice are way too high in acid if you have an injured bladder. You got to lose that. But did you know that cranberry juice is also very, very acidic? In fact, cranberry juice is actually worse than lemonade. We call cranberry juice the acid bomb. And so many, my first year of IC, I am not lying. I drank a quart of cranberry juice a day. I had it at work on my desk. And over that period of a year, I got worse and worse and worse and worse. Why? Why did I end up in the emergency room several days in a row? Because I was pouring acid on the wounds in my bladder and just making them bigger and bigger and bigger. Once an IC support group leader, my first IC support group leader, her name was Sally, and she was here in California. And she was the one who first gave me a clue in that cranberry juice was bad. And I had no idea how bad it was. And I literally was scouring my bladder with acid every day. So lose the cranberry juice and many cranberry supplements, honestly, they're still too acidic. There are some cranberry supplements that have the acid taken out. A good example is Prevent, which can be taken for if you struggle with recurring UTI. But for the most part, we want to back away from cranberry. Now, our next very, very spooky food is going to be anything with artificial sweetener. Anything. No Diet Coke, my friends. No diet anything now. Now, why do I say that? Number one, NutraSweet aspartame is metabolized into a very strong acid. And so it's formic acid. So it's known to be very bladder irritating. And if you look at the FDA approval for NutraSweet, bladder irritation is listed as a side effect of doing a lot of NutraSweet. There's also formaldehyde in the mix. Formaldehyde is a pickling agent. Formaldehyde is a carcinogen. Formaldehyde is used by morticians to help preserve bodies. And yet, in some cases, some foods can be metabolized into formaldehyde. And that's, again, a known carcinogen. But more importantly, artificial sweeteners are linked very, very strongly to obesity. Now that doesn't make sense, does it? Come on, you're not eating sugar. Why would you become more obese? Well, the fundamental problem is your brain, actually, because when you put something sweet in your mouth, your brain goes, ooh, energy coming, and your brain prepares to receive that sugar. And of course, artificial sweetener is like 1,000 times sweeter than regular sugar. So the brain goes, ooh, lots of energy coming, and gets ready for it. But because it's a fake sugar, it doesn't arrive. And so the brain, half an hour later, goes, wait, where's my sugar? Where's my energy? It hasn't arrived. And so what happens is your brain goes, oh, well, I guess we better get more. And you start snacking. You notice when you do artificial sweetener, you just snack all day. And that's your brain going, hey, you're faking me out. I need sugar, so I'm going to make you eat sugar. If you're not going to give me something real, you're going to start snacking a lot. And these are not little studies. These are studies with tens of thousands of patients that have proven a very strong connection between artificial sugar and obesity. And my aunt was one of them. I had a beloved Aunt Shirley, love her dearly, lost her a couple years ago. She struggled with obesity, but she was completely addicted to Crystal Light. And that's all she drank. And no matter what we said to her, and she was very smart, but she was very, very addicted. And so no matter what we said to her, she just drank Crystal Light all day. And her weight just got bigger and bigger and bigger and bigger. And that was one of the things that ended up, I'm sure, contributing to her death. Okay. Now, it also might surprise you to know that last year, the World Health Organization, the premier medical institution in the world, actually banned, or don't have the power to ban. They recommended that everybody avoid all artificial sugars, that the risks outweighed the benefits. That's the World Health Organization. The only exception they made was sugar alcohols, erythritol. They said, okay, maybe you can have some of that. But then last year, we had new research with erythritol and new research with xylitol. I used to suck on xylitol tabs for dry mouth. It turns out these are linked to blood clotting, strokes, and heart attacks. Yes, really. I mean, come on. Here, we're doing everything we can to try to, lose weight, and bam, there we go. So let's follow the World Health Organization guidelines and let's just lose the artificial sugars. And instead, I use honey. Now, here's the other thing that shocked me, because I've already had my fright of the year. At this point in time, pretty hard to scare me because you already gave me the biggest scare of my life, which is breast cancer. And so when you see me rubbing, it's just because my incisions are very tender, and they're still very tender, and it's very annoying. Anyway, did you know that sugar causes cancer to grow? And this is proven in research studies. Not only does it cause cancer to grow, it causes cancer to metastasize. So I am now cutting massively back. I mean, I would have sugar on, in my tea, and anyway, I am doing everything I can not to eat sugar. Only if I need a little bit of energy will I do a little bit of sugar. So yeah. Okay. And here's the heartbreaking one. Our last spooky food known to cause a flare. And this is the part that's so painful on Halloween. Chocolate. I'm sorry, chocoholics. But chocolate is very well known to trigger migraines. It is very well known to trigger icy flares because it is Lori guessed it, chocolate. And the cheaper the chocolate, such as the chocolate you get in Halloween candy, the worse the flare. It's just not processed well. So if you got to do chocolate, you need to do dark chocolate, like a dark, expensive chocolate, or you can do a white chocolate. Like Kit Kat right now has like Halloween candy called Bones, and it's actually white chocolate. That should be fine. That's not going to trigger an icy flare. I mean, that really should be fine. And better yet, carob. We want to go with carob. So that is my list of the most scary, spooky candy for Halloween. Yeah, I mean, who doesn't like a piece of candy? I love a piece of candy. And I think the candy that, if I were eating a lot of sugar, I would be doing Nerds. I like kind of the sour sweet combination. I like licorice. But I like the Nerds. Nerds are really good. Go figure. Maybe it's because I'm a nerd. All right. Okay. Whoops. My cape is falling off. You know what? I think we can take the cape off now. Okay. So I truly hope that you have a wonderful Halloween, because I had the best memories of Halloween as a child. Absolutely the best memories ever, ever, ever. They're my happiest memories of my childhood, of me and my sister going around the neighborhood and just bringing it in, baby. But it was really even more important were the neighbors who dressed up their houses, and they tried to make it really, really special. And so I hope that if you believe in the holiday, I hope that you have a really good Halloween. All right, let's go ahead and take some of your questions. Now, one thing, YouTube, you guys, hey, can one of you guys on YouTube write in the chat, please? Because I'm not seeing a chat right now. So either I'm nailing it, you don't have questions, or there's a problem with the chat. So YouTube, if you could do that, I would really appreciate that. If somebody could say hi. Okay, let's go back. Renee said pure monk fruit without alcohol sugar is okay. I use honey too. I get the pure monk fruit off of Amazon. Good suggestion. When I made a lot of cookies and breads like that, I always cut my sugar in half. I never did a full dose of sugar anyway. It's just way, way, way too much sugar. And now again, I'm gonna try to bake with honey now. I really want to try the honey, and let's see what we can do with that. April says, can somebody tell me how to send this to a friend so they can watch too? Just copy the URL, hon. If you're on your web browser, just copy the URL and send it to them in email. That's the web address. URL stands for web address. Rebecca says, my doctor put me on amitriptyline and Tagamet. The combination has really helped my pain and urgency and frequency. If the Tagamet is helping, does that mean my bladder issues stem from mast cells and histamine? Not at all. Exactly the opposite. Because Tagamet is an acid reducer. It's an antispasmodic, if I remember correctly. Yeah. It's not an antihistamine. At least I don't. Is that a mechanism of action? Here, hold on. Let me just look. Let me just make sure. I used to do, yeah, no. Okay, wait. I'm wrong. It is a histamine that inhibits stomach acid production. It is used for heartburn and peptic ulcers. I was wrong. But it's kind of a, there's multiple effects here. It's acting by reducing acid. And so what that implies is that your bladder wall is more vulnerable. So you might be an estrogen atrophy patient, or you might be a Hunner's lesion patient. and that it's the acid irritating the wounds in your bladder that's triggering a flare. Is the antihistaminic portion of Tagamet providing an antihistaminic effect on the bladder wall? And I'm a pharmacologist. I mean, that's my degree, is drug development and pharmacology. I don't know. I mean, it's acting on the stomach. The question is does it remain an antihistamine after it's metabolized and goes through your kidneys into your bladder? I don't know. The amitriptyline calms nerves down. If I were to make a good guess, I think that it's really focusing on the fact that by reducing the acid levels, it's helping your bladder a little bit more. I don't think that the antihistaminic effect is going to reach the bladder to any great degree, but that would take a little bit more research. It's a good question. Lori says, is there another tasty coffee besides Dandy Blend? You just need a variety. So another tasty herbal coffee, Dysfx, Calf-Free Roma, and Pero, P-E-R-O. So those are herbal coffees that we used to sell before Dandy Blend came around. Dandy Blend is just, in my opinion, more flavorful. But again, Dysfx, C-A-F-I-X, Calf-Free Roma, which is K-A-F-F-R-E-E-R-O-M-A, 2 words, Pero, P-E-R-O. And those are all available at my local grocery store. So hopefully you can find them at your grocery store. Christine said, why do urologists prescribe antihistamines? They dry up mucous membranes. Okay, so I know I have a great slide on this. Okay, hold on. I got a great picture that explains that. Let me see if it's in this book. I got a big skirt here. Again, for those who came in, this is my Halloween costume. Okay, I want to see. Did I put the picture in here? I did not. This is our book, IC 101. So, okay, where is it? Where is this picture? Come on, memory. I know exactly where it is. It's in one of my magazines. Hold on. The question is, let's see. Is it up here? Okay. Okay, let me see if I can find this. So the IC Optimist is our patient magazine. And this is where I do my best work, is in our magazine. It comes out 3 or 4 times a year. Only 3 this year, because I was out this summer with cancer and surgery. Yeah. Here it is. Okay. This is from my summer 2018 magazine, where every summer I review the class taught on IC at the American Urology Association for doctors, because I think it's really important that we know how doctors are trained. You know, we have got to make sure that we understand the good and the bad of what they're being taught about IC, you know, because 40 years ago, they were told that IC was a mental illness. So, and of course, it's not. We don't believe that anymore. But anyway, these classes are very, very important. Okay, here's the diagram. So the first thing we have is a bladder injury. Okay, so let's just say you went through chemotherapy and it hurt your bladder. So what does that do? That damages the bladder wall. We have an epithelial layer damage. This then allows urine to get into the urothelium, into the cells, and trigger nerves and things like that. Okay, so when that happens, when urine gets in, it activates C fiber nerves and the release of something called substance P. And substance P, which happens, again, when nerves are very irritated, causes mast cells to release histamine. And the more histamine you've got in there, the more the nerves get irritated. So you get stuck right here in this, actually my finger's going the wrong way. So what happens is you get stuck in this vicious circle of mast cells releasing histamine, that's irritating nerves. Nerves are releasing substance P, that's causing mast cells to release more. That causes more injury, which then damages the bladder even more. Okay. So the reason why they give you an antihistamine is to break that difficult cycle. If we can get you out of that cycle and calm that down, the more we control histamine release, the more we calm the nerves down. So that's exactly why they ask you, some of you, to take antihistamines. Now, the other really interesting thing is many patients flare during allergy season. And that's talked about in another one of these from a couple years later, that they basically say for those patients who flare during allergy season, we want you to make sure that you're using an antihistamine to try to calm that allergenic process from happening. And for those who are on, who get asthma, they have even more medication suggestions for that. If the offshore winds are blowing, if you're in San Diego and the winds are blowing out towards the ocean, or here, we had heavy winds here where I am in Northern California, all of our allergies triggered, lots of congestion. Now, the next question that Christine asked is, does estradiol cause cardiac issues? Well, as somebody who is on estradiol, let's get the facts straight. We know that the loss of estrogen is going to weaken muscles. It's going to weaken your skin. And so the very first thing that comes up here from the National Institutes of Health is estrogen has cardioprotective and prothrombotic effects, which can impact cardiovascular health. And so what the National Institutes of Health, National Library of Medicine, 2017, let me just go, oh, it's a big long article. Let me just go to the summary here at the end. That's a pretty academic thing. I don't think you're going to understand it because I don't. In summary, estrogen treatment in the form of oral contraceptives and hormone replacement therapy have been linked to an increased risk in venous thrombosis, strokes, because it has a modulatory role on coagulant and anticoagulant factors. Research demonstrating that tamoxifen exhibits antithrombotic effects further suggests that estrogen therapy or estrogen is involved with coagulation, but a long-term study is needed. And yet, it is also believed to be protective in some ways. Let me just see if I can find that statement. This is a really academic article, I don't think. The lower incidence of cardiovascular disease in women during reproductive age is attributed at least in part to estrogen. Estrogen 2 binds to traditional estrogen receptors, estrogen receptor alpha, estrogen receptor beta, as well as recently identified G protein coupled estrogen receptors. This review summarizes the protective role of estrogen and its receptors in the cardiovascular system and discusses its underlying mechanisms with an emphasis on oxidative stress, fibrosis, angiogenesis, and vascular function. The controversies around the clinical use of exogenous E2 as a therapeutic agent for cardiovascular disease in women due to possible risks of thrombotic events and arrhythmia are also discussed. So, my friend, it sounds like you need to have a good heart-to-heart with your doctor and your cardiologist. You know, oral estrogen. Obviously, oral estrogen that you swallow, it gets distributed throughout your entire body. And oral estrogen is really only prescribed in somebody under the age of 60 who is struggling with severe symptoms related to menopause. And it's a short-term therapy, a couple of years at the most. If you're over the age of 60, estrogen or oral estrogen is not recommended because of its greater risk in triggering estrogen-driven cancers like breast cancer or like uterine cancer or cervical cancer. And so topical estrogen is the estrogen we turn to because topical estrogen is put on the skin directly. So for those women who they're so dry, their vulva is so dry, their urethra is so dry, their bladder is so dry, their vagina is so dry, they are struggling with very, very intense discomfort, burning, etc. Topical estrogen stays in that skin and improves the health of that skin without the greater risk of breast cancer. So when we think about our options here, oral estrogen, speaking as a breast cancer survivor, you really have to understand the risks. You got to do your research. You've got to talk to your doctors about it. Topical estrogen, do your research. But again, topical estrogen in the latest research in the last 5 to 7 years has been found to be quite safe. I asked my oncologist about it just a couple of months ago. How do you feel about topical estrogen? She's like, fine. It stays in the skin. Now, I will say that I have backed off a little bit, even from the topical, because honestly, I just had the blank scared out of me. And so instead of doing estrogen 2 times a week, I'm only doing it 1 time a week right now because I just decided for my own peace of mind, I just needed to back off just a little bit. And I'm not having any problems down there. I'm not having dryness. So yeah, now that might change in 5 years. That might change in 10 years. And I might need to use a little bit more then. But ultimately, our goal here is to improve the quality and health of the skin. And topical estrogen does that. But again, it's a very personal discussion that you've got to use. All right. And again, I do not understand what's going on with YouTube. YouTube, I'm sorry. I can't read anything on YouTube. So if you guys on YouTube have any questions, pop me an email, icnetwork@mac.com. That's short for Macintosh Computer. icnetwork@mac.com. If you want to email me a question, we can look at those. Jen, right when we started the meeting, said that she's now suffering from GIrd. Oh, um, I did a survey of IC patients a couple years ago because when you actually start hanging out with IC patients, it doesn't matter what the phenotype is. There's a lot of GIrd in this patient population. And yet the research studies that looked at related conditions didn't ask people about stomach issues. It asked them about IBS and bowel issues and other things, but they didn't probe about stomach issues. And I was really surprised to see out of the hundreds and hundreds of patients who participated on our study that gastritis and gastroparesis and GIrd were pretty common in the IC patient population. That makes me wonder. My guess on that is we've all been exposed to so many antibiotics over the years because all of our doctors assumed that we had a bladder infection. That the antibiotics maybe damaged the biome in our stomach, the biome in our bowel, and that might be why we have more stomach issues. It's crazy. All right, Sue says, have you given any suggestions for help from CBD to help with flares and what form? Sue, yeah, we did a study on CBD. In fact, that's still going on. I think over in the IC Network Survey Center, we've been doing it for a couple of years now. I can tell you that IC patients prefer edibles over smoking or vaping by far, and that products that are high in CBD, low in THC were preferred by the IC patient. And hold on. What's interesting, what's it in this one? Let me see if I can find it. One of the doctors teaching the AUA class on IC specifically mentioned CBD supplement. CBD suppositories, vaginal and rectal suppositories. Okay, where was it? I know. I swear it was this one. It was Robert Muldoon's wife, Jen, who was talking about it, and she even mentioned brand names. Yeah, here it is, right here. Okay. Medical marijuana was first used in patients struggling with multiple sclerosis in a double-blind, placebo-controlled study. It decreased nocturia by 30%. How? Because the bladder contains cannabinoid receptors, making it a viable target for treatment. Medical marijuana acts to inhibit directly on the smooth muscle of the bladder. It has been delivered directly into the bladder as agulemic acid. And the speaker shared that they are seeing great success using medical marijuana suppositories, specifically mentioning the brand Fairwinds Cannabis. That's Fairwinds Cannabis, infused vaginal suppositories and the brand name is Feminine Relief, or rectal suppositories for men called Rectify. And so this was suggested by Robert Moldwin's wife, Jennifer Fariella Moldwin, who is one of the top nurse practitioners for IC and does a lot of direct IC patient care. Here's another really good diagram from this course. You know, a lot of people remember that we have phenotypes. We now know that 85% of IC patients, 85% of patients have tight pelvic floor muscles. That's straight from the research. So why does that trigger bladder symptoms? And this diagram explains it, that when you have a pelvic floor spasm, that triggers the symptoms of IC-IBS, vulvodynia, irritable bowel, fibromyalgia, and UTI. And what does that do? That causes increased pain, poor urinary flow, urinary hesitancy, constipation, dyspareunia. And then when you strain to empty your bladder, it makes it all much, much worse. That the more you strain, the more you get stuck in this vicious cycle of tight pelvic floor muscles triggering urinary symptoms, et cetera, et cetera. Sue says, last week you mentioned PEA 500. I have trouble swallowing, so most couples I open and use in applesauce. Can I do this with PEA 500? I know that the manufacturer discourages that, but you can actually buy PEA powder on Amazon. In fact, I have a tub of PEA powder on Amazon that I've been playing with as a topical to use on my surgical incisions. So PEA powder, the thing about PEA is that it doesn't dissolve in water. And so it's what we call drug delivery. The drug delivery, or the delivery of the PEA into the human body, can be challenging. And so, yeah, but you can buy PEA powder. In fact, let me go get it. Hold on, and I can show you the one I have. Hey, quick bathroom break. So, sorry, this is a really big skirt, so it gets stuck. So here is an example of a PEA powder for those who cannot swallow pills. And it's just, I don't know if you can see that, it's just a very, very easy white powder. So PEA acts to calm nerve sound. For anybody who's not familiar with it, in 2019, we had a PEA IC study that was remarkably successful. That 87% of IC patients who used PEA for 3 months had a significant reduction in their pain and discomfort. with some becoming symptom-free. And when that study came out and was presented at the American Urology Association annual meeting, the urologists who were attended got very, very excited because they could finally suggest something that had a really good chance of reducing pain without the risks associated with an opiate medication. And so PEA has really transformed how we're approaching pain in the IC patient population, and not just IC pain, but shingles, IBS, vulvodynia, lots of different things, migraines, etc. Anne says, what does hydroxyzine do? It's an antihistamine. Sue says, I've been on Gemtoza and I feel like it might not be working as well. Do you know if I take a break, it can help again? Or perhaps what could be added to help with the frequency, urgency, or the need to get better sleep and quality of life? Let me look, hon. Hold on. So Gemtoza is an overactive bladder medication. It's designed to reduce frequency, urgency, not pain. It is not a treatment for quote unquote interstitial cystitis or Hunner's lesion. So what you have to do is we have to try to focus on underlying causation. What is causing that frequency urgency? Is your frequency urgency being caused by dryness from estrogen atrophy? If that's the case, we need to get your bladder wall healthy again. And Gemtoza doesn't do that. Gemtoza just calms down symptoms. It doesn't fix anything fundamentally. It's kind of like taking a pain med. When you're taking a pain med, you're just trying to calm the pain, but you're not fixing anything underneath it. And there's nothing wrong with that because you're suffering. Controlling pain is important. But ultimately, we have to try to get to the underlying cause of it all, the underlying cause of the pain in the first place. So that frequency urgency is coming from the alpha afferent nerve in your bladder wall. Now we have to figure out why that nerve is being triggered. So again, is it being triggered because it's not being protected because you don't have the mucus anymore? That's possible. Is it being triggered because you're ingesting something with caffeine? That's possible. Is it being triggered because you're drinking something with acid that's irritating the skin? That's possible too. Guys, I'm always available during the week on the phone. You can sign up for a coaching session, or if you just have a couple questions, just call. Happy to take your phone calls and your questions because maybe we can get down to the underlying issue, Sue, to try to figure it out. Denise says, I'm so discouraged. I went a month with no pain, doing everything right, sticking to the low acid diet, going to physical therapy, using my hormone cream, and now I'm in a flare for 3 days. Why does this happen? It's not bad, but it's there. Pressure, achy, lower belly area. Well, Denise, number one, this is fantastic that you had a great month. So you are living proof that you can get better. You are living proof when you look in the mirror, you can say to yourself, look, I can get better. So we don't look at IC as an illness anymore unless you have Hunner's lesions. We look at IC as injury or trauma, that it's a neuromuscular disorder. So one concept here is that 3 days ago, you hurt your pelvic floor muscles again. Did you have sex? Were you in a car for a long period of time? Did you fall? Were you under periods of very, very intense stress? Those would all trigger flares. And that's the thing is, and I think that's for anybody who is an athlete or is an aging athlete, and I was a very, very good athlete when I was in my 20s and early 30s. I'm now 64. All those old injuries have now come back. And, the irony is that when you're young and you hurt yourself, you just power through it. Well, when you're older and you hurt yourself, you can't power through it. Like it takes longer to heal. And so I have a lot more aches and pains that go right back to the sports that I played when I was younger, like my SI joint on my left side, my sit bone on my left side, my shoulder on my right side, my neck on my right side. I mean, the list goes on and on. Getting older is just so annoying. Another thing we want to look at is, could you be having a hormone flare? Very normal to flare when you ovulate or a couple of days before your period. But those are very, very short-term flares and nothing to worry about really at all. So you go back 3 days ago, and tell us, what do you think triggered this flare? Cindy said, how do I feel about oxalates? Oxalates are well known to irritate the vulva. They're very, very fine crystals. And so some patients with vulvodynia and some patients with IC find that when they go on a low oxalate diet, they feel better. And so a low oxalate diet is going to be things like no spinach, no chocolate, no berries. You can Google oxalate diet. Sorry, these incisions just, they annoy me. Marcella says, I've had my Hunner's lesions cauterized twice in the past year. I'm concerned about the scarring. I'm having issues again and want to know if you can tell me about the triamcinolone injections. Yeah, Marcella. Marshila. Thanks for joining. Really appreciate it. So Hunner's lesions, as you know, are visible wounds on the bladder wall. Hunner's lesions, when you biopsy a Hunner's lesion and you look at them, these are wounds that are filled with a massive amount of inflammation. Inflammation is your body fighting something for the most part. And so if you biopsy somebody without Hunner's lesions, they have a normal bladder pathologically. You biopsy a Hunner's lesion, it is a biological war happening inside that lesion. And now we have a clue as to what's causing that, because it was researchers in Europe who started finding virus in the urine of patients with Hunner's lesions. Specifically the Epstein-Barr virus, the mononucleosis virus. And now we have not only multiple studies that have identified virus in Hunner's lesion patients, but including our own National Institutes of Health did their own viral study, and they too found the Epstein-Barr or the polyoma BK virus in roughly 5% of patients, and this is associated with Hunner's lesions. So when you think of a bladder infection, don't just think about bacteria. You want to think about virus and fungus also. So concept number one here is there any chance that you have an active viral infection? You can read that research on the IC Network website, icnetwork.org. Go on over and check out that section on Hunner's lesions. I'm finding a lot of patients with lesions have a history of mononucleosis, and some have active mono infections at the time that the lesions appear. We are also now studying the use of antiviral medications for patients with Hunner's lesions. But this is a very new research. I think we had our second or third study released at AUA last spring. And I believe that they're testing a medication called Valtrex, which is an antiviral that's often used for shingles and herpes. Another thing that is a very, very exciting is that we had a research study come out in August with something called lactoferrin. So lactoferrin is a protein found in mother's milk and colostrum. Lactoferrin is one of the important elements of our immune system, and it's very, very important for a new baby to get a lot of colostrum when they first start nursing, because it builds their immune system. So lactoferrin has antibacterial, antiviral, and antifungal effects. So for the last 2 years, they've been testing lactoferrin specifically with a bunch of different diseases. Last year, the lactoferrin researchers proved that it was very helpful in the prevention of recurring UTIs from E. coli. That's spectacular. And then in August of this year, we have a lactoferrin IC study that found that Hunners, so basically they took lactoferrin for about 3 months. There were 31 patients in the study. They all had a history of bladder wall flares, some severe, some minor. At the end of the study, 28 out of 31 had no bladder symptoms, no flares. When they measured their inflammatory markers in their bloodstream, they had all gone down. And when they looked at their bladders again after therapy, red bladders had become pink and healthy, and Hunner's lesions had healed. So this is the first over-the-counter supplement where we have direct data showing that it has the potential to reduce Hunner's lesions. And I have it on my shelf here. Here it is. So lactoferrin is a simple over-the-counter supplement that comes from cow's milk. Now, we just had here in my county our first outbreak of bird flu. And last year, there was so much bird flu across the United States that millions of chickens and ducks and turkeys were euthanized. But they found bird flu in milk and grocery stores also. It doesn't appear to sicken the cows like it does the birds. It literally kills the birds. So a flock of 50 birds last week here in my town is our first outbreak of the year of bird flu. So I'm a little uncomfortable with domestic sources that come from cow's milk right now. Granted, we need a lot more research on it, but I decided that I wanted to bring in a lactoferrin from Australia instead, and that's what I did. So the lactoferrin that we sell on the IC network comes from Australia, where they do not have the bird flu like we do here. It's just been devastating to the poultry industry and the egg industry. You can buy really cheap lactoferrin on Amazon, but we don't know where it comes from. And again, I'm not comfortable with stuff coming from China, and I'm not comfortable with stuff coming from the American milk industry right now. I'm sorry to say, yikes. So I brought this in. And unfortunately, it's a little bit more expensive, but you would only do it for 2 to 3 months. So anyway, you can find, let's see, I haven't written the paper up on that study yet because I was recovering from my double mastectomy. But you can Google lactoferrin interstitial cystitis and see that study yourself. Okay, now triamcinolone is a steroid that's injected into the center of a Hunner's lesion, and that just calms inflammation down. And the advantage of that is that it doesn't leave scar tissue. So you have a correct question, and that is having multiple cauterizations in your bladder does leave scar tissue, which reduces your bladder capacity because the scars don't stretch. Whereas the steroid injection, the triamcinolone injection, does not leave scar tissue. A lot of doctors do a combination of the two. They will do a steroid injection and a little bit of cauterization. But now that we have the lactoferrin research, I think that this opens up a whole new ballgame for us. Denise says, topical estrogen helped me so much. I was in agony before with intense burning. Yes, I'm so glad you're using it, honey. I'm so glad you're using it. Hi, Sue. She says, I hope you're doing well. I have a question. If you have a family history of endometrial cancer, should you use topical estrogen? The research says that it's not associated with endometrial cancer when compared to oral estrogen. That said, I can understand your hesitation. And I think that you're going to have to look at the research a little bit more and have a good conversation with your doctor. She too says her mother's cancer has come back. It's estrogen driven. So now I'm afraid to use it now, but it does help me. Listen, I've had a total hysterectomy and now I've had a total breastectomy. And out of cancer, and I still use it. I just don't use a lot of it. I just use a little bit. It's really my urethra that starts to scream when things get very dry. So when I use my estrogen, I tend to use it right at my urethra. Sue says she's recently developed new Hunner's ulcers. Anne says, what does hydroxyzine do? It's an antihistamine, honey. Sue says, thank you so much, Jill. I followed you and prayed for you. Thank you. How much PEA powder do I use? Do I mix it with anything to take orally? Oh, I don't have my reading glasses. As a dietary supplement, take, it looks like 1 heaping scoop, which is approximately 450 milligrams. Yeah, so they have instructions on it. So just follow the instructions. PEA has no known drug interactions that I've seen, and some studies just say we know of no drug interactions. Very well tolerated. It's what I take. I take Fiora twice. I took 2 last night myself. My goal is to keep my nervous system as calm as I can, and PEA helps me do that. Nancy says, my doctor, my uro guy, prescribed amitriptyline and hydroxyzine. She wanted me to add Urabel as well when flaring. My pharmacist warns about an interaction problem. Are you aware of an adverse event when using both? The doc has many patients on both. Well, let's see. So amitriptyline. Combining amitriptyline and Urabel can increase the risk of a rare but serious condition called serotonin syndrome, which may include symptoms such as confusion, hallucination, seizure, extreme changes in blood pressure, yikes, increased heart rate, yikes, fever, excessive sweating, shivering or shaking, blurred vision, muscle spasm. Yeah. They want you to avoid monoamine oxidase inhibitors, MAO inhibitors, and because they can cause a serious and possibly fatal drug interaction. I say listen to your pharmacist. Your pharmacist is going to be much more in tune with the drug science and drug interactions than your local doctor. Also understand that amitriptyline is an anticholinergic medication. Anticholinergics, when used long-term over time, are linked to cognitive decline. You take it every 3 years, every day for 3 years, you run the risk of like a 50% increase in the risk of cognitive issues and dementia. So they're trying not to prescribe amitriptyline for long periods of time, or a combination of multiple anticholinergic meds like overactive bladder meds like ditropan or Detrol. So the antidepressants, the antispasmodics, even the antihistamines have anticholinergic behavior, which can cause dementia if you use a lot of it over time. Instead, people are switching from ladetrols and ditropans to something called mirabegron or Miratrix, which reduces frequency, urgency, but it doesn't come with that same risk. Unfortunately, it's a little bit more expensive. Denise says, could chia seeds cause a flare? I don't know, hun. Nobody's ever asked that question before. If they're salted and spicy, I don't know. I mean, I don't eat chia seeds, so I don't know how they come, but I really don't know. Sue says, I would like to set up a conference. How can I set this up, Sue? You can just call. Tomorrow's my day off. And Tuesday, hold on. Girl, I'm going to a new pelvic floor physical therapist on Wednesday. Okay. So I will be here on Tuesday. Ooh. Dang. But Wednesday, I will probably not be here most of the day. And Halloween is Thursday. Nice. My goal in seeing this new fully certified physical therapist is I want to stop my left butt cheek from vibrating when I sit too long. Like it's doing it right now. It doesn't hurt, it vibrates. If I sit for long periods of time, there's something right around my left sit bone that starts to quiver. And because I had to sit so much after surgery, it just massively exacerbated whatever that problem is. So my goal in going back to physical therapy is to try to see if we can figure out fundamentally what is causing this vibration sensation, because it is driving me nuts. You guys, when I'm looking here, I'm looking at Facebook. When I'm looking over here, I'm looking at YouTube. So just bear with me here. Angie says, hope you're doing good. I just worked 16 straight days for our fall festival. My psoas and my iliacus is screaming. So much pain. Girl, get that hot shower, hot bath, muscle relaxant. And, if you got some Flexeril, baclofen, heating pads, anything you can to get those muscles to calm down. Amy says, I'm still sore 4 weeks post-hydro distension, probably my 6-1, but I'm flaring. Hunner's gone, but severe profuse glomerations, trabeculation, and petechiae. So, Amy, you really shouldn't be having pain from the hydro 4 weeks after the hydro. I mean, 10 days, yeah. A month, no. What that suggests, that suggests a couple of things. The first thing it suggests is, did they overstretch your bladder? Did they do what we call a high pressure, long duration hydrodistension? Because the more you stretch the bladder, the more you injure the bladder. And so patients who have had very, very big hydrodistensions, I mean, literally, even the bladder can rupture like a balloon if you stretch it up too much. But if you look at our national guidelines that first came out in 2011, they specifically say no more high pressure, long duration hydrodistension. We want to reduce trauma. We don't want to increase trauma. So it kind of implies to me that they did a high pressure method. Is there blood in your urine? Did you have a lot of blood in your urine after you had that done? And she says she's trying everything. Okay, Amy says yes. They held it for 5 minutes, but you usually go 3. And again, we don't know what pressure they used either. You have bladder spasms at 200 ml. She held the urethra with a finger and then held it to 600 ml. And you had blood for a day. Girl, yikes. I mean, you say that you've had a lot of treatment for Hunner's lesions. Like you've had 6 hydrodistensions. I'm assuming that they've cauterized the lesions every time. And so now, if that's true, now what we have is a scarred bladder with a smaller capacity. Because remember, your bladder's like a balloon. It shrinks and then it fills, and then it shrinks and it fills. Well, every area that they lasered doesn't stretch as much. So parts of it stretch and parts of it don't. It's just maybe it was a little too much. I mean, maybe it was just a little bit too much. And it physically, Amy says they're usually helpful. I don't know, got rid of the lesions. They used to inject with cortisone, no fulguration. Okay, so you did not have the fulguration. Girl, I would try the lactoferrin, because we had such a good study released this earlier this fall with lactoferrin making red bladders pink and healthy and eliminating Hunner's lesions. At this point, there are no side effects. This comes from cow's milk. Even if you're lactose intolerant, the company said that there's not enough lactose in this to trigger a lactose reaction. No side effects in the IC study. We have lactoferrin in all of our bodily secretion. Okay, now hold on one second here. You also got what we call a nosocomial staphylococcus infection in your bladder from the procedure. Holy mother of God, girl. Yikes. So that supports giving lactoferrin a try, since it's got the antiviral and antibacterial effect. Do you feel like the antibiotics killed it? I mean, the problem with nosocomial infections is they often are very, very drug resistant because they're coming from a hospital environment. So how did they treat it? How did they treat it? And do you feel like the treatment worked? I mean, there's always a chance that you still have remnant staph in there messing with you. You're taking D-mannose. I hope this will heal. I'll take the lactoferrin. I had better days on antibiotics like Keflex. Amy, what I would do if I were in your shoes is I would do a next generation DNA urine test, because next generation DNA urine tests are far more specific than a typical urine culture, because they don't try to grow a bacteria in some sort of medium. Instead, they actually just blend up the urine, kill everything, and then they harvest the DNA. And they use the DNA to identify the specific bacterial species and family. And then they compare it to these giant databases of antibiotic resistance. And so you will get a big list of the antibiotics that could kill it versus the antibiotics that it might be drug resistant to. I was working with a patient last week who, she did a vaginal next-gen test and she did a urine next-gen test. And she had a number of drug resistances that really I hadn't seen before. And what that means is that she has been exposed to some pretty aggressive infections. Your urogyne offered the test. Do it. Do it. No hesitation, because it's data. It's useful data. Some doctors don't like it because they don't know how to interpret the results. Others love it especially infectious disease specialists, because it will find those infections that a urine culture won't grow. And so no hesitation, I would definitely do it because it's very, very useful information. Because on one hand, you could have a super drug resistant staph. On the other hand, you could now have a fungal infection. The staph could be gone because of the antibiotics you took, but now you might have a fungal infection in your bladder. And the next generation DNA urine test is the only test that will identify that fungus. And so that's important too. All right, you guys on YouTube, you're very quiet today. I know you're there because I can see you watching, but you're pretty quiet. Will the staph go away? I just need some hope. Honey, the urinary biome and the vaginal biome are works of art. You know, we have urine is not sterile. We have good bacteria in our bladder. We have bad bacteria in our bladder. And ultimately, our health depends upon the health of our biome. And a good, healthy biome has enough good bacteria to control the bad bacteria. But when you take antibiotics, the challenge here is you kill all the bacteria. So then it takes time for the good bacteria to grow, and that gives the bad bacteria an opportunity to grow also. So this is not an overnight thing. I mean, it's important that you do live cultures. So, you know, eat your yogurt a couple of times a week if you can. Take some good probiotics. We've got to restore and restock your biome, get you healthy again. Amy says you were in a, and so Amy, just and understand that when you correct that biome, you're going to put the good bacteria in there that will keep the staph in check. But I think that the lactoferrin might become your best friend. I mean, it's certainly worth a shot. She says, I was in a four-year remission, only flaring 2 days a month. Honey, that's not a remission. The fact that you flared 2 days a month, it says you were not in remission. Your symptoms were very, very mild. That's good, but your symptoms didn't go away. And so you need a good phenotyping here. We need to try to understand what's driving these symptoms. What is driving these symptoms? Is it estrogen atrophy? Is it tight pelvic floor muscles? Is it Hunner's lesions, an infection? I mean, we're really taking a much deeper dive into the many potential causes of these symptoms. But again, you know, Hunner's lesions have been connected with 3 things. Number 1, the most common is a virus, a viral infection, Epstein-Barr mononucleosis. So again, they are now testing antivirals. And the first round of data shows that when you give these patients an antiviral, there's no sign of virus in their urine. So that's good. The second known cause of Hunner's lesions is something called posterior fornix syndrome. Basically, a really, really severe nerve injury that happens when a ligament that holds the uterus in place is damaged, and the uterus starts to spin, and that starts twisting nerves. And when we unspin it and get it healthy, the Hunner's lesions go away. So you can find that on the IC Network website too. That was a case study that was published a couple years ago. And then the third theory behind a Hunner's lesion is that it's just severe neuroinflammation, that nerves are very, very inflamed. You have the Epstein-Barr virus, but no treatment? Girl. There we go. And you have had 2 C-sections. So it would be fascinating to have a blood test to see if you have active Epstein-Barr right now. All doctors say no treatment. Well, then again, the lactoferrin, worth a shot. You know, but we've got the research that is firmly connected Epstein-Barr with Hunner's lesions. So maybe they just haven't seen that research. If you call me on Tuesday, I'll give you links for that research. You can find it on the IC Network website, but I'll give you the direct links. You can print out those studies. You can give them to your doctor and say, hey guys, listen, I know you really don't want to treat my Epstein-Barr, but guess what? I'm having problems in my bladder that could be from Epstein-Barr. Here's the research to prove it. Why not give it a try? Why not try some treatment? Here, hold on. Come on over to IC Network, icnetwork.org, icnetwork.org, and you can start that research there. And I will try to send you some too. I just might not be able to send it to you right away because I'm going to have to jet to go to a family thing. All right, guys. Well, listen, it's 2:25. We've been here for an hour and a half, and I have a little 3-year-old niece that's having a birthday party today, and I've got to drive a half an hour to get there. So I think we're going to call it here. I should be back next week. If you have any questions, number one, if you like what I do, please subscribe to my channel. Come on over to the IC Network, join our mailing list, because that's where we do our work. Better yet, come into the IC Network shop where you can buy things, you can become a member, get our magazine, all sorts of good stuff like that. All right, my friends. Okay, I'm going to call it here. I will see you later. I'm going to say goodbye to YouTube first. Bye, YouTube.